Thank you so much, Katie, and thank you all for joining today's session about effective health. Somehow I was muted. I'm so sorry. Welcome to our session. Oh, okay. Well, onward. Welcome to our session on effective health center board orientation and ongoing education. As Katie said, my name is Emily Hurd, and I'm the Director of Health Center Governance Training at the National Association of Community Health Centers, known as NACHC, one of the many, many acronyms that we always throw out to our health centers and health center board members. I've worked in governance for about 18 years, but it is my distinct honor and pleasure to now work with health center board members because, as you all know, our patient majority and community-based boards are truly at the heart of our health center movement. I'm going to turn it over to my colleague, Mario, to introduce himself.
Thank you very much, Emily. I'm Mario Garza. I'm with the National Center for Farmworker Health in the training department. NCFH is an NTAP offering programs, products, and services on program management, governance development, staff training, and health education resources. And we recently celebrated our 45th anniversary. In this presentation, we are going to heavily utilize polls, provide a lot of links for you, and we're going to be using the chat box. So be sure to have that popped up. Now, before we begin our presentation, I'd like to highlight our organization NCFH's ongoing Board Governance Learning Collaborative. As we've worked with various boards, we've heard a lot of existing challenges in training board members, and we're trying to fill that gap. In response, NCFH is currently hosting the Board Governance Learning Collaborative focused on board education, where we're bringing health centers together to provide tools for consumer board members and understand the need to provide board training. Health centers development of a board training plan is one of our priorities. So we have created this opportunity to gain a training plan as well as access to board member training resources. Recruitment is ongoing, and we shall expand more on these details in the presentation. So we'll start our presentation and later ask for your feedback when we preview one of the e-learning modules that we've developed in collaboration with NACHC. By the way, if you'd like more information, you can contact me at garza@ncfh.org for more information on this learning collaborative. Let's jump in. Our objectives today are to increase knowledge and active engagement of consumer board members. We're going to also expand your awareness of how boards can integrate e-learning programs and other resources into health centers' training plans for board members. To do this over the next hour, we're going to do a quick level set about board roles, talk about practices for ongoing board education and orientation as well. We're going to preview 2 e-learning modules that can be used for your own board's orientation and ongoing education, and we're going to be seeking your feedback on these. And lastly, we'll be taking your questions. Now, before we dive in, let's jump into the chat. We'd love to know who's in our audience. Let us know in the chat if you're a board member, you're a board trainer, or you work with the board in some capacity, or if you're an executive at your organization. I'll give you a couple of seconds just to do that. And just pop in the chat and just type in there. You can put the acronyms. You can just quickly add any comments that you'd like before we go on.
Mario, I see a few board members, actually several board members. That's terrific. Thank you so much. So, you know, as I said in my opening, we really can't thank our board members enough. I think we know that you join boards because you're dedicated to the mission of health centers and that you're volunteers. And I've worked with many boards in different mission areas over the years, but I think health center governance is perhaps one of the most complex areas. And so that's why, you know, today's focus on orientation and ongoing education is so important. But as Maria said, we do want to just start with a level set about health center governance and board roles. We have so many board members joining us that I know I don't need to necessarily remind you of this. But one thing that makes governance so unique is that the board operates as a collective. Individual board members don't make decisions. It's the board as a whole entity. So essentially you're joining a team, and that team has to be effective. This is one framework that we've found to be successful in talking, especially with new board members, about what a health center board does. So we know that boards must ensure centers' compliance with federal and state as well as local laws. As a result of receiving the grant through the Health Resources and Services Administration, known as HRSA, and its health center program, there's also a number of requirements that boards and board members need to be aware of that are included in the health center program compliance manual. And I see that Mario has added that to our chat. But then also we want you to be aware of the board's broader roles and good governance practice. And so we want to make sure that you're aware of a resource called the Governance Guide for Health Center Boards, which really takes a A to Z approach, if you will, about board roles and puts them into the context of those HRSA Health Center program requirements. So the link is on the slide here. It is available in English and in Spanish. And we will go to the next slide. Which is, we just also wanted to say, we're also finding it is more approachable to describe board roles in 3 broad categories, because as adult learners, categories of 3 are easier to remember than a long list of board responsibilities. And so we're talking about board roles as falling into a strategy bucket, secondly, an oversight and policy bucket, and then finally a functioning bucket. And if we go to the next slide, one of the things that Mario and I will be doing throughout today is making sure that you're aware of various resources that you can incorporate into your recruitment process, your orientation, and your ongoing board education programs. And so we do have a video available called Health Center Board Roles. The link is on the slide that is available to you. It's a 10-minute introduction to board roles in that framework that I shared, and it can be a helpful tool for both ensuring common understanding of health center board roles, but as I said, also for your orientation programs. And Mario, we'll just go quickly to the next slide just to give you a sense of what's covered in that video. Under strategy, we talk about the board's strategic composition, as well as strategic planning and thinking. As we move forward, as we consider the board's oversight and policy role, of course, we talk about the board's need to approve policy as well as provide oversight in so many areas, including of the CEO, of finances, of quality and corporate compliance. And then finally, we talk about the board's responsibility on the next slide for its own functioning, right? So making sure that its meetings are working out well, which we know this year with the pandemic, those have been largely virtual meetings. Board committees are functioning and board culture. And so really here, we just wanted to start with this level set around what are the roles of a board and provide you with that resource. And we'll go forward again. Next slide, and actually you can just quickly go through this slide, Mario, just maybe 2 more clicks. This is just a recap of the legal duties of individual board members. And this is something that you can incorporate into your own board orientation programs. So next slide, please. So as we really dig into the heart of today's session, which is going to focus on board orientation and education, what this graphic does is it helps us envision the life cycle of a board member, right? You spend a lot of time recruiting board members, finding folks that are the right fit for your health center. Then you invest time in orienting them and making sure that they feel like they have what they need to be actively contributing to the board. Our research, though, shows that the most successful processes also then result in that board member becoming fully affiliated with the board, really feeling like they have a place, like they have a voice, and like they know exactly what their role is. And that in turn leads to more active participation. And so that's sort of the why we're focusing on these 2 components today, because it is so important to make sure that you have affiliated and participative board members. Next slide, please. So just quickly, board member orientation. We have a compass here. I think it probably goes without saying that is really a process that prepares new board members for their new volunteer role. Next slide. And we've learned in the pandemic that new board members are really feeling less confident and less connected than in the past. With board meetings being primarily virtual, new board members stepping onto boards at this time of physical distance and space. But what that is in turn leading to is the refinement of some really helpful and good practices around new board member orientation. So first and foremost, you probably remember the days you maybe have participated in the type of orientation where you might gather in a conference room or gather in a room and go through a lot of information really, really quickly. And I think in particular, this moment in time has really caused boards to pause and take a step back and realize that the orientation process really starts with considering what are the technology needs of new board members, and for that matter, all board members, but in this case, new board members. Are you issuing a tablet or a device for your board members to be able to access information and participate in a board orientation program or board meetings? Are you spending time to make sure that they know where to find important information and know how to use the device? So that's sort of step one. And we've seen a lot of boards and health centers really decide, okay, this is the moment in time where we're gonna start issuing devices for that purpose. The next step is, probably most of you also have always provided a board handbook, and this is not necessarily a physical document anymore, right? This might be a website, it might be a place on your board portal if you're using that, where you provide a new board member with important background information that they need, like a list of board meetings, times, dates, committee lists, bylaws, things of that nature. And then from there, we're seeing, usually this is a committee-led process. So you might have a governance committee or a board development committee that takes the lead, really use and follow some innovative approaches for board orientation. So there's three that I wanted to make you aware of today. The first is a multi-session approach, where it might be, a couple of hour-long or 2-hour-long, perhaps video meetings or socially distant meetings to start orienting board members to some of the basics. And boards are finding they're having great success by dividing up the focus areas. So your first orientation session might talk about an overview of the health center. The second orientation session might talk about board roles. The third session might talk about the healthcare landscape and the impact of the pandemic, as an example. Another approach is a staggered approach, where some health centers are saying, there's so much information for new board members. We're going to identify the top 5 things we think our new board members need to know before their first meeting, and then have periodic orientation over an extended period of time, perhaps the first 6 months. And then finally, some boards are turning to a customized approach that really is tailored to the needs of an individual board member. If you're like me, when I look at financial statements, ironically, we're going to preview a training about financial statements in a few minutes. But when I join a board, typically I need a little bit of extra time looking at financial statements, whereas other board members might really need to have, might not be as familiar with the health center services. Perhaps they need to focus on, thinking about quality. So this approach really considers the needs of an individual and lays out a customized orientation plan. The last thing I want to mention is the importance, especially right now, of considering a mentor or buddy program, where you match a new board member with a more seasoned board member. Perhaps they have a phone call before the new board member's first meeting. It's somebody that new board member can turn to ask questions or to help them sort of figure out processes that are used during board meetings. I was recently talking with a board chair, and she said, we just want to make sure that new board members really know how to find their voice and how important they are for us. And so what I would encourage all of you to do as you think about the approach and how maybe your own orientation program might be refined, especially in this moment, to really consider that. The real purpose is to make sure that our board members feel empowered so that they can get to that affiliation circumstance. So Mario, we'll go to the next slide. And we did have a quick chat question we wanted to pose to you. We wanted to get your sense of what focus areas are important to cover with new board members. I know we have a lot of board members who are participating today, so if you wouldn't mind just taking a minute to enter into the chat what you think is important to cover in a board orientation program. And we also have a few other questions that you could take back for your board, to your own board on this slide, like what key performance indicators should new board members be aware of? What would a mentoring program look like? And so, Mario, why don't I keep an eye? Oh, here we've got some. So functions of the board and different roles. We can go to the next slide as we have a few more coming in. This is just a short takeaway on some brainstorming that Mario and I had done in terms of potential focus areas, certainly helping board members understand board roles, helping them really become oriented to the mission, vision, values, and strategic plan, really understanding the HRSA Health Center program. So this is a takeaway. And in the chat, I will also include a link to a short article that we have put out about orientation during the pandemic that you can access as well. So Mario, with that, let's move forward. And then this slide quickly just links to some of the resources that I've mentioned already, and Mario is going to preview for us the modules on board financial oversight, so I'll turn it over to him.
Thank you very much, Emily. Yes, as you can see, there was a good amount of resources already available, and we're going to preview all e-learning module that NAC and NCFH have been working collaboratively to translate into Spanish and to provide to board members as one of their training tools. So as we've been working collaboratively to fill the gaps of the training needs for board members, we've had this focus in mind, and we've gathered that Spanish language resources are in high demand, especially for board members. The e-learning module is the first in a 5-part series that examines the Health Center Board's role in overseeing its financial health. This module provides an overview of the board's role in the financial oversight of a health center and discusses the responsibilities of individual board members in carrying out this important oversight. In order to accommodate different training methods, these modules can be viewed by individual board members or by the full board as part of its ongoing board education, or you could also utilize this during a new board member orientation. So with this outline, we'd like to present this, and after we view this e-learning module, we'd like to get your feedback through a poll. So be ready for that. And I see some conversations coming in the chat. So I'm going to go ahead and pull up this e-learning module. Now, this is what NCFH and NAC have been working together with. For the convenience of the English speakers, you're going to have, you should be seeing right now the English caption on the bottom. I'm going to go ahead and play it right now. You should be seeing it now here. And let me know if the volume's okay.
Durante este módulo, voy a presentar una visión general del papel de la Junta Directiva en la supervisión financiera de un centro de salud y discutir las responsabilidades de los miembros individuales de la Junta para llevar a cabo esta importante supervisión. En los otros módulos, va a aprender cómo leer y comprender la hoja de balance, el estado de resultados y el estado de flujos de efectivo, así como indicadores clave de rendimiento. Empecemos. La Junta Directiva, como grupo colectivo, tiene la autoridad para gobernar el centro de salud. La Junta dirige la organización y aprueba el plan estratégico que establece la dirección y las prioridades estratégicas del centro de salud y guía el presupuesto y la toma de decisiones. La Junta también tiene la responsabilidad fiduciaria de tomar decisiones en beneficio del centro de salud. Un deber clave de la Junta Directiva es la supervisión financiera. En su conjunto, la Junta es responsable de las siguientes actividades: aprobar y supervisar los presupuestos, revisar estados financieros regularmente, tales como el estado de resultados, la hoja de balance y el estado de flujos de efectivo, asegurar que existen controles financieros, aprobar políticas que apoyan la administración financiera y los sistemas de contabilidad, revisar la auditoría, y revisar el formulario 990 del Servicio de Ingresos Internos, IRS por sus siglas en inglés. La Junta Directiva también debe tener un comité de finanzas y posiblemente un comité de auditoría para apoyar esa supervisión. Es importante revisar las leyes en el estado en el que opera el centro de salud para ver si se requiere un comité de auditoría separado. También se considera una buena forma de gobernanza separar los comités de finanzas y de auditoría si la organización hace auditorías externas. El director general, CEO por sus siglas en inglés, que es seleccionado y supervisado por la Junta, ayuda a la Junta y a sus comités manteniendo personal financiero clave, entre otros, que tiene el conocimiento necesario para respaldar la preparación de información financiera correcta. Esta información se dará al personal de la gerencia y a la Junta.
And excuse me, I'm going to pause it real quickly. I'd like to clarify that we wanted to make it, the English speakers to follow along as we're presenting the Spanish module. Everything's in Spanish. And I want to now jump into the Spanish module so everyone can see it. It's the exact same. Everything's translated. And so you're going to see here that
Junta Directiva para su uso en la supervisión y para apoyar la toma de decisiones informadas. Estos estados financieros también deben prepararse de acuerdo con los principios de contabilidad generalmente aceptados y las regulaciones federales que rigen el uso de fondos federales. El director de finanzas, CFO por sus siglas en inglés, y el Departamento de Finanzas son responsables de preparar estados financieros y es la responsabilidad de la Junta Directiva trabajar para entender la historia que cuentan los estados financieros. Según mi experiencia, miembros de la Junta Directiva que no están familiarizados con los estados financieros evitan hacer preguntas. Es probable que esto se deba al temor de que sean juzgados o al temor de que otros miembros de la Junta Directiva tengan una mala opinión de ellos por su falta de conocimiento en el área de finanzas. Es la responsabilidad de cada miembro de la Junta Directiva comprender y cuestionar, si es necesario, la información financiera que se les presenta. Por lo tanto, es importante crear una cultura en la Junta Directiva donde las preguntas sean bienvenidas y una práctica común. Este módulo y el resto de la serie ofrecen algunos de los fundamentos de las finanzas del centro de salud que pueden ser útiles para nuevos miembros de la Junta Directiva o servir como un repaso para otros miembros de la Junta Directiva. Después de completar los 5 módulos, debería comprender mejor los términos de finanza, los estados financieros y su propósito, los indicadores clave de rendimiento que se deben vigilar, las preguntas que se le debe hacer al CEO y al CFO para juzgar el estado financiero de la organización y otras responsabilidades financieras. Idealmente, este conocimiento le ayudará a hacer más preguntas y tomar decisiones más informadas cuando participe en las reuniones de la Junta. En última instancia, esto lo ayudará a guiar y apoyar la misión y la visión de su centro de salud. Vamos a comenzar nuestra discusión explorando los presupuestos que deben preparar el centro de salud. Los centros de salud deben preparar 2 presupuestos cada año, el presupuesto operativo anual de la organización y el presupuesto total presentado a la Administración de Recursos y Servicios de Salud, también conocido como HRSA por sus siglas en inglés. El presupuesto operativo de un centro de salud es una predicción de ingresos y gastos. Los presupuestos se basan en los resultados anteriores y deben reflejar cualquier cambio anticipado. Estos pueden incluir cambios en lo siguiente: número de pacientes y citas, dotación de personal, proveedor y de otro tipo, formas de reembolso u otras fuentes de financiación, planes de expansión y otros elementos que influyen el rendimiento financiero. El presupuesto operativo debe compararse con el rendimiento real del centro de salud, generalmente en el estado de resultados discutido en el módulo número 3, sobre una base mensual y anual para que la junta directiva pueda entender si el centro de salud está funcionando como se esperaba. Si hay desvíos significativos respecto del rendimiento esperado, la junta directiva debe cuestionarlos y comprender por qué. Desviaciones significativas son cantidades suficientemente altas como para que las finanzas se consideren inexactas si no se actualizan. El presupuesto operativo debe actualizarse durante el año si las proyecciones usadas para preparar el presupuesto cambian en una cantidad que sea sustancial, es decir, una cantidad significativa como para que las personas que usan los estados financieros noten la diferencia. Por ejemplo, un sitio nuevo que estaba programado para abrir el próximo año, pero no lo hizo, cambiaría materialmente las proyecciones de ingresos y gastos. El centro de salud puede considerar revisar su presupuesto operativo para reflejar este cambio. Se requiere que el presupuesto total o presupuesto de la subvención se prepare y presente anualmente a la oficina de HRSA, mientras el presupuesto operativo se espera ser más ambicioso y que represente el desempeño del centro de salud si cumple con sus objetivos estratégicos. El presupuesto de la subvención no debe ser excesivamente ambicioso. Se requiere que el presupuesto de la subvención balancee a cero y debe representar los ingresos y gastos para todas las actividades dentro del alcance.
I'm going to pause right there. This was just a preview of the e-learning module that NAC and NCFH have been putting together. And I wanted to give you a preview, especially for the non-Spanish speaking members here in the audience, over how the translation, we've translated everything, including the text from English to Spanish, so it can be available for board members. Now, I'd like to also point out, as I mentioned earlier, that it's been one of the most high priority and demands to have Spanish language resources available for board members, because we're seeing that that a lot of board members are needing that as a resource, especially new members. And so we'd like to get some feedback from everyone. I'm going to go ahead and get this down and go back into the slide here. And I'd like to get some feedback from everyone. And using a poll here, I'd like to see, and there's two methods of utilizing this poll. You can use your phone by sending a text to Sylvia Gomez 225, and you can send the numbers 22333. And we're going to answer this simple question. We want to know, just over this quick preview, we want to see if this financial module meets your needs in understanding financial oversight. And once again, this was a quick preview over a very general module that is encompassing general oversight for board members. And so feel free to, I encourage to also use the chat as well. If you don't want to go to the website up there or use the text, you go ahead and use the chat box, and you can simply type in yes or no just to answer this one question over if this financial module meets your needs in understanding financial oversight. And I'm going to go ahead and select this. In fact, you should be prompted, if you're going to the website, you should be prompted that it's going to activate right now. There we go. And in the chat, folks are saying, yes, that's fantastic. And Jessica also chimed in that a lot of mentees actually asked that question, and they appreciate the Spanish option as well. And that's what I wanted to preview as well. Since there certainly are a good amount of resources for board members in English, we definitely want to expand that, and we want to provide, especially in a very general sense, for the board members, especially if they're coming in brand new members, or if it's for a refresher course for existing members. I'll give you all just a couple more seconds so you can go ahead and answer in the chat, or go ahead and fill this out in the poll as well. In the polls as well as coming in, it's all yes so far, which is what we were expecting as well. Now, one last poll question just for everyone, just for our feedback, because feedback is one of the most important things that we need. And as we develop this board training, we'd like to see And I'm going to make sure that everyone's done here. And it looks like the poll is slowing down right now. So I'm going to go ahead and activate the next poll, which is asking more specifically, if your organization has a board training plan already in place, can this module be incorporated? And you'll use the same methods. You can go to the website. You can also just send a text if you'd like through that method. You send a text to Silvio Gomez 225, and you'll text 22333, or you can just go ahead and use the chat. The chat is good enough and makes it much easier. Looks like folks are saying, yes, this can be utilized, and that's exactly what we want to see. That's what we were expecting, at least in all the case studies that we've done. As we work to develop training materials for board members and also board member trainers, we're open ears and feedback. And foremost, we aim to disseminate these modules and let everyone know that these modules are available. So you're welcome to view them and utilize them for your trainings, and we strongly encourage comments and suggestions for ongoing feedback. And I posted the links to these modules as well online, and I can post them at the end for your convenience. Yeah, okay. And thanks for everyone chiming in here. It's great to see the feedback. And it looks like it's slowing down now on the other side of the poll. So I'm going to go ahead and just copy the responses, and people are replying yes as well. Thank you for your feedback, everyone. One other thing I wanted to touch on, we mentioned there was a second module that we've worked on so far with NAC. So NCFH has translated a second e-learning module focusing on the balance sheet. This e-learning module provides an overview of the balance sheet, focusing on how it is put together and how to interpret its meaning. It's created similarly to the first module we just presented, where it can be viewed by a full board as part of an onboarding process or viewed by individual board members. It could also be used in board member orientation. You can find this module in NAC's online library under the Health Center Governance section, and both NAC and NCFH offer a substantial online library of training tools and resources on board governance. I'm going to go ahead and put that in the chat so you all can have access to that as well. And let me know if you have any questions so far. And that's where I'm going to open up. If any immediate reactions that anyone has, feel free to put it in the chat. If anyone has any additional comments on resources, or feel free to submit in the chat right now if you can. And as I mentioned, feedback is crucial in our development. And once again, we're making these modules known. We really want to make these modules known through health centers, since it's one of our priorities. In most presentations, I know we usually get eureka moments and questions after the forum is done or after the presentation's done. So if you have any additional comments, feel free to email me at garza@ncfh.org. I'm going to go ahead and put that in the chat as well for your convenience.
Mario, I wonder if you also want to let folks know there are several forthcoming modules, right, that will delve into additional learning about statement of cash flow, about the balance statement, and about key performance indicators. And so all of those modules are available now in English, but as Mario has been describing through this partnership between NCFH and NAC, the other ones will be coming soon. And so please be on the lookout for those using the links that Mario has put in the chat. And I think now he's doing a screen share to show you what you will encounter.
That's right. Thank you so much, Emily. That's right. As NCFH and NAC are partnered together to collaborate in translating these modules, NAC has an overwhelming and fantastic online library here in this section. I can provide that link as well. And you can find the English resources as well as the Spanish resources there. And you can see there's a good amount of modules already ready to use in the English modules, and NCFH will be translating and transforming these as well for Spanish-speaking board members. Just to give you an idea of everything that's available, and to find the Spanish-speaking ones, Capitación Financiera para la Junta Directiva is found right there in that tab, and you can see the two that we just spoke about right now. And I'll go ahead and post this one for the Spanish resources. Thank you, Emily. Let me go back to the slides.
Yeah. And before we do pivot to ongoing board education, we've had a lot of feedback that these modules are really helpful because, if you do incorporate them into an orientation program, a new board member can still go back and watch it on their own and spend some time just sort of really becoming familiar with some of the financial oversight language that can be really unique related to health centers. And so just wanted to sort of relay that. But with that, we're going to move forward in our discussion and talk about ongoing board education. And so we've talked a lot about orientation. We've given you some resources that we hope are helpful to you as you orient new board members. But we all know that the learning does not end with orientation. To continue to build that affiliation of your board members as well as the participation, ongoing board education to make sure that all board members have the information and knowledge needed to govern is really crucial. And so we just wanted to spend a little bit of time exploring some specific strategies. So Mario, we can go to the next slide. And just to give you a sense of some suggested approaches for ongoing board education. So one of the most popular approaches is really integrating time into board meetings. And we see boards do this in several ways. Some boards dedicate perhaps even 10 or 15 minutes at every board meeting. The board chair and the CEO might collaborate and look forward and sort of see what's on the horizon for the health center that the board needs to learn more about. It might be in anticipation of a big decision. Your board might have taken a self-assessment and realized that it needs to brush up on a particular governance area. And certainly during the pandemic, there has been absolutely no shortage of new things to consider every board meeting. And so in the chat, I'm going to include a link that you can find various resources, short articles really, including many available in Spanish about governance considerations during the pandemic. Everything from how are boards thinking about the future, to telehealth governance considerations, to the impact of the pandemic on quality oversight and financial oversight. Each of those articles have discussion questions that can be used with your board. And so we're finding some boards are actually assigning a board member to read an article and then present on the topic at their board meeting, or it might be a staff member doing so, but really taking that approach to ensure that there is ongoing time for board learning is helpful. We're also seeing boards, of course, continue to use board retreats. And so many boards have had virtual board retreats this year, perhaps, again, focusing on the future or doing a little bit of a level set on board roles and responsibilities. In just a minute, Mario is going to tell you more about the fabulous NCFH Learning Collaborative that's available to support your learning. And then, of course, participating in outside trainings like this. All right, next slide.
Thank you so much, Emily. Yes, and I'd like to take a moment to speak about our ongoing learning collaborative that we have. As mentioned earlier, we have made a commitment to build board's capacity. And so with that in mind, Health Center's development of a board training plan is one of our priorities. We're bringing health centers together and trying to fill in the demand in board onboarding and training as well. So NCFH has partnered with NACHC, as I mentioned, to provide these tools. And so these resources are substantial for board education. The Learning Collaborative for staff and consumer board members focuses on enhancing the delivery of governance training to positively impact engagement of consumer board members serving in health centers, delivering all these healthcare services, of course. In partnership with NACHC, the Learning Collaborative participants will access newly developed training modules designed specifically to support and enhance board governance. So learning sessions will focus on roles and responsibilities of board members, developing educational modules through the digital e-learning course like the one we previewed, and topics on leading a workforce during a pandemic. So staff recommended to participate include consumer board members as well as leadership staff responsible for board training. If you're interested in learning more, consider joining this Learning Collaborative. Recruitment is ongoing, so it's not too late to join. The Learning Collaborative will provide access to these resources discussed and a board training plan, and of course, an opportunity for peer-to-peer partnerships with other board members or executives as well. It's a great opportunity, so feel free to reach out to us. If not right now in the chat, you can also just send me an email at garza@ncfh.org. And now we'd like to open up into another discussion here for the audience, so really engage everyone.
So we're curious about what focus areas do you think are important to cover as part of ongoing board education? So this might be, this might be a topic that you're currently working on, or it might be something that your board has discussed at a recent meeting or had a recent training on. What has been important for your board to really focus on in terms of ongoing learning? And again, please feel free to use that chat area to enter this in. We welcome all of your ideas. And Mario, I know, the Learning Collaborative, of course, is going to lift up the impact of the pandemic. And that has just like it has impacted everything within health centers, it's impacted everything boards do, right? In terms of oversight, in terms of thinking about the future, and in terms of how boards operate. And I see here one board did some ongoing education about policy governance, and certainly the pandemic has presented lots of opportunities, if we'll use that word, to adapt policies, to make sure that policies are up to date given the current environment. And I know you had another question that you wanted to pose to folks as well.
That's right. Yeah, as I mentioned, feedback is important to us. And so we'd like to see what other training needs do you have for your board? And I see that Jessica has chimed in that board governance is a hot topic. Cultural competency, absolutely, we've seen that. And of course, hence why we see the demand for Spanish resources. Anybody else have anything else that has come to mind? And like I mentioned, of course, sometimes it's after the forum that we'll have these ideas of, oh, I should have brought this up. And so we'll always be available. And so feel free to reach out to us. But definitely, we want to get everyone's feedback at this moment so we can start working and implementing all this feedback into our development.
And I should just add, as folks think about other training needs, part of the reason why NCFH and NAC are collaborating on short modules is really because we had requests from board members and CEOs that said, we really want short, digestible items that we can share with our boards. We don't want to sit through a long session. We want something really, really targeted that we can easily digest and discuss. And here I see Vicki adding in quality measures related to community health and health equity, certainly both very, very important topics. And the pandemic has certainly lifted up in particular an impact on quality measures that boards will be looking at, and the importance of health equity.
That's right. And this discussion won't end. Even if we go to the next slide and such, we want everyone to know that. Feel free to chime in into the chat. We'll be happy to answer any questions as they come in. I'm going to jump on over here.
Yeah, and so some of the areas that you all offered up in the chat are some of the areas that Mario and I also brainstormed on in terms of really topical issues for ongoing board education right now, right? So of course, the impact of COVID-19 on the center. As I mentioned, there are a series of resources that you can access on the links that I've shared in the chat that talk about the impact on various types of oversight. We actually have a few short videos forthcoming that are going to address, in particular, oversight of all of the grant funding that has come into health centers and what boards need to consider on that. So impact of the pandemic, value transformation. Really, again, this is not a concept that's gone away. It's still important for board members to learn about that transition from volume-based to value, health center strategy. I saw somebody mentioned health equity already. And then, of course, governance best practices. And we'll remind you at the end of some additional resources that are available about governance best practices. So let's move forward. So actually, here it is right here. So just as a reminder, the governance guide for health center boards, which is also available in Spanish, that really is a resource that provides an overview of board roles. It breaks up every single board role into a specific chapter that you can assign a board member to read and present, or you can, have all your board members read a particular chapter and discuss it. And then we also, as I've mentioned, we have those COVID-19 focused resources. And then we do have several additional short videos that have been released in the last couple of months. One on the board's role related to needs assessment, a whole series about the board's role related to strategic planning. So what is the board's role in strategic planning? There's also an online case study where you can put yourself in the shoes of a board member and think through the strategy questions that their board is contemplating. We also have an introduction to accountable care for health center boards. And Mario, I know NCFH has a fabulous health center toolbox. Do you want to share a little bit more about that?
Yeah, absolutely. Our website at ncfh.org actually has a health center toolbox, which is pretty much like a database encompassing a variety of tools and resources that health board members can utilize, as well as their staff and executives as well. It's not just specific to board members, but of course you can find a good amount of resources on there. It's a growing library as well, so it's going to keep on expanding. As mentioned, we are going to be translating even more of those e-learning modules with specifically for board education, and so keep an eye on that. I'll be posting the link as well. And thanks, Emily, for posting in the chat. And so, yes, always look into our website. It's ever evolving, ever developing. And we're also going to have a good amount of different materials in various modalities. And so we also take feedback and suggestions based off of that. If you feel like your board members or your staff in training need a different approach, a different modality, we give it to us. That is exactly what we're seeking. Even if it's not the content, if you can give us feedback on how we can deliver it, and as long as we see that it's gonna actually be positive and fantastic, we'll work on it. And so this is the time that we want to bring this out into the open, let everyone know, especially board members, that this is available and that our organizations are available for that feedback. And before we continue as well, yeah, Ron is reminding us and the administrators that we have 10 minutes to wrap up, and that's a good time for us to open it up for everyone. One quick thing, as Katie has wrote in, if you're seeking the CEUs, follow the link right there, and she's put more information in the chat box. And you'll see that the chat is actually going to be filled with more links to all these resources that we're viewing. The presentation will be available by CVent into the website, so be sure to check where you registered online. So you can find the PowerPoint as well. I'll also be posting these links in the chat right now, so you can also have them at your convenience at the immediate moment. And this is what I mean. The chat is just overwhelmed with all the resources. And this is just a glimpse right here, just to give you an idea. And I've included in there the Health Center Toolbox as well. So be sure to look in there whenever you have a chance.
Yeah, Mario, one other thing that I'm going to just add to the chat right now, of course, NAC and NCFH have partnered, but we also know that you have fantastic state and regional primary care associations. And so I wanted to also identify for you a brand new series from the Health Center Association of Nebraska that talks about health center program compliance and how boards can successfully prepare for things like that operational site visit. And so I did also, we didn't have it in time for the slides, but I did also include that in the chat in case anybody is interested. And so I did see a quick question that came in earlier, Mario. Let me just get back to it. Amy asked, do you have specific training to BIPICs or HRSA expectations of migrant health centers with an overview of migrant health centers' mission, board structure, and bylaws?
Do you have specific and BIPIC expectations of migrant health centers with overview of the migrant health centers' mission, board structure, and bylaws? It's a good question.
This website that you're on just answered all my questions.
Oh, perfect. Okay, great. Okay, that's great. And I was going to actually say that I was on the toolbox today, actually, and there is under that becoming a migrant leader in migrant health, a great resource that's still quite applicable. So great, Amy. Thanks for that. Didn't want to miss your question though.
Right, and thanks a lot for that question, Amy. I've provided the link as well to the Health Center Toolbox, and so you'll see it on the top of that last text I just wrote in. Excellent, wonderful. Yeah, Good.
And folks, as we give it another few minutes for questions, I do really want to echo what Mario has said, which is we hope that this is the start of a conversation. We invite you to reach out to either of us at any time to let us know what you need. All of these resources have been developed, as we both said, in direct response to hearing from board members, to hearing from staff that support boards. Our job is really to make your lives easier as you govern health centers, as you provide staffing to health centers. We know that you're carrying a tremendous weight in service to our patients. And so our job is to make your job, whether volunteer or paid, easier. And so we will make sure that at the end of the slide deck, you have both of our emails. And please feel free to reach out to either of us at any time. As Mario said, sometimes the best ideas come after you leave a session. And so, we invite you to reach out at any time.
Mm-hmm. And of course, we want to open this time up. We only have about 6 minutes, but we want to see if anybody has any additional questions, any even suggestions or comments. We're definitely open ears at this point. I know there's only 28 of us so far, but this is, I wouldn't be surprised if someone is just holding it in right now for some type of question. Maybe if there's something that you've been struggling with or grappling with so far, especially during this past year, this is a good time to get our focus as we're all here together, and you might even get some comments from someone in the audience as well.
Or even if you've had a great success that you want to share, maybe you've adapted your orientation program during this time, or you successfully onboarded a really great board member. We also want to hear those success stories as well.
Absolutely. Absolutely. Yeah, that's a great point. Yeah, if there's any successes, anything that you've seen that's been revolutionary as everyone's been transitioning in the workforce, this is a great time. And just so everyone can see, of course, we'd like to provide our contact information just so you can have it right in front of you. Brought to you by NCFH and NAC. Once again, my name is Mario Garza, and we have Emily Hurd here as well. And it's been a pleasure speaking with everyone. And also, don't forget the evaluation. That's one of the most important things. Thank you, Katie. Katie just posted the evaluation for this session. Please be sure, it's also another vital tool that we're utilizing. And so be sure to go ahead and click on that link, evaluate it, or just go ahead and copy it and do it later on at your convenience so we can have that submitted. I might just count to 10 to make sure to get everyone started, to make sure they have their chance. We have about 3 minutes here. So it's been a pleasure speaking on behalf for NCFH and to provide these tools. And I know it was overwhelming maybe on the chat with all the links, but this is exactly what we're tackling and what we want to make your lives easier on. We want to provide these resources. We want to make sure that you are supported. And that's exactly our role here, both as an organization and in our individual roles in the organization.
Absolutely. And everything is linked in the slide deck. So you can also access that where you logged in to join the session. And thank you. Thank you so much for your participation in chat and for all that you do every day.
Wonderful. And thanks for everyone for chiming in as well. We'll be stopping the recording here, and we appreciate everyone's attendance.